Welcome back, everyone, to Engage at Home, brought to you by Montgomery County's Caregiver Support Program. Today, we have an episode that's really focused on an outstanding organisation here in Montgomery County. You're going to learn about some of their work and, most importantly, a program that they have right now that's focused on helping you deal with compassion fatigue. So, Shanza, would you please introduce yourself?
Sure. My name is Shanza Lewis. I'm the Communications Specialist at Primary Care Coalition and manage external communications and digital media.
Thank you and welcome. Blanca, would you please introduce yourself?
Yes, I'm Blanca Cuervo. I am a registered nurse and a clinical social worker, and I am a supervisory behavioral health care manager at PCC, and I provide direct services at 2 of our community clinic sites.
Wonderful. So welcome to both of you. I know that you are the experts in the field. So what I'd like you to do is just briefly tell us a little bit about who is Primary Care Coalition.
Primary Care Coalition is a healthcare nonprofit in Silver Spring, Maryland. We provide access to healthcare to low-income, uninsured individuals in the community who otherwise wouldn't have access to primary care, specialty care, behavioral health, or other services that they need. We provide those services through 10 safety net clinic organizations in Montgomery County, and we work with a network of community organizations to ensure that all our community members have access to care regardless of their personal financial circumstances.
Thank you. And Blanca, you deal with this on a day-to-day basis. You are a nurse and a social worker. Anything more to add to what we just heard?
Nope, that pretty much sums it up.
Thank you. I know that you have an amazing presentation planned, so I'm going to hand over everything to you. Thank you, and I'm looking forward to seeing this.
All right, so today we're going to talk about our virtual compassion fatigue training offer. So what is compassion fatigue? Well, compassion fatigue is when caregivers are providing care to their clients who have experienced some sort of traumatic event, and the caregivers experience residual stress and residual strain from working with their clients. And some symptoms of compassion fatigue is that it affects your overall well-being. You may have issues sleeping, or you may have heightened feelings of sadness or anger. You can't concentrate. You're making mistakes often at work. You're just feeling low and disconnected from your work. And just other physical or emotional or mental issues surrounding your work with your clients. So that's just a general overview of what compassion fatigue is. Blanca?
Right, so you might be asking why we want to provide compassion fatigue training. And as Shanza was saying, with everything that's kind of going on right now, I think the world as a whole is kind of experiencing some trauma and grief related to COVID-19. And as healthcare workers, we're trying to provide a lot of services and resources for our clients. And while doing so, we're also experiencing the same trauma and grief as our clients, of the people that we're trying to help. I think in general, healthcare and social systems are being very overwhelmed. There's a lot of demand and need for resources, and it's hard to connect people, or sometimes there aren't enough resources, and that can create some moral injury. So people might get more discouraged. And again, as this crisis continues, there's going to be more chances of us experiencing cumulative moral distress, which will result in compassion fatigue, burnout, or post-traumatic stress.
Right. So Blanca is a direct service client provider. I work mostly on the back end in administration, so I don't have a lot of interaction with patients. But during COVID-19, I have friends and family who are healthcare workers, and they have expressed, especially during the height of COVID-19, what it was like providing care to COVID-19 patients who had to be put on ventilators, or who they didn't have the resources to help, or they were reusing PPE, and they were fearing for their own safety, and they were fearing for the safety of their family, because, you know, they're working with patients with COVID. They may carry the virus back to their families, or they have to quarantine themselves. So a lot of people at PCC understand what healthcare workers are going through. Maybe Blanca can give a story on her end about that. But just generally, me keeping my ears open as an external affairs professional, I hear a lot of communication from healthcare workers about compassion fatigue and what it means to be providing this care during this crisis.
Right, and I think, like you were saying, you know, I don't work directly in a hospital, but I do have nurse friends who, you know, talked about having to use the same N95 mask for an entire shift.
Yeah.
You know, working in a pediatric setting with children who are who have to do chemo, and they're high risk, so they're, you know, they're immunocompromised. So
Right.
it's scary. You know, you're right. You want to provide the care, and then you have to come back home to your own families, and you want to ensure their safety. So, and even patients as well. You know, being I have patients who are very more anxious in hospital settings, patients who were intubated or who just have to get oxygen due to COVID.
Right.
And it's scary, it's different, and it's been very overwhelming.
Right. So that just puts a lot of emotional strain on healthcare workers and clients and everyone involved in managing this crisis. So we are providing compassion fatigue training virtually under a SAMHSA grant. The workshop will teach strategies for healthcare workers to protect themselves emotionally while providing compassionate care to their patients and clients. Trauma-informed strategies to reduce the compassion fatigue they may develop, or acute stress or post-traumatic stress disorder from, you know, working with COVID-19 patients, or fearing for themselves or their clients or family members. And these psychological impacts of being a healthcare worker during a global crisis, you know, it's not a regular event. They're used to providing care on a continual basis, and they see, you know, they see patients who go through crises, but a global crisis is a different ballgame altogether. So we want to help them develop strategies and help them develop ways that they can protect themselves and continue to provide care to the people and clients that matter. Blanca?
All right, so this is a kind of a busy screen, but basically we're offering 2 3-hour sessions. The trainings are virtual, and the participants can replay the training for 30 days. And below we kind of have a schedule. So you'll see that we set up essentially 4 sessions for healthcare workers, and then 2 sessions for leadership. So kind of more for like the administrators. And we have the dates below. And again, registration is free. And we have the website below, which is primarycarecoalition.org/CFT. We've also attached next to it our lovely flyer that Shanza has created. And this workshop is being taught by Charlene Richard. And she is a clinical social worker in the University of Calgary in Canada, I believe. Yes.
Yeah.
So again, she's kind of the go-to person when it comes to, you know, trauma-informed trainings. And she's also the founder of Caring Safely. So she will be providing these trainings for us. Again, they're free, they're online, and we think it'll be very useful. Oh, and we do have CEUs pending for licensed counselors. And we'll keep you guys posted on that.
Okay. So that's the end of our presentation. You can contact us, Shanza_Lewis at primarycarecoalition.org or Blanca_Cuervo at primarycarecoalition.org. As we mentioned, the registration site is primarycarecoalition.org/CFT. If you have any questions, concerns, comments, let us know. You can email us. All right, that's it. Lily?
This is an amazing group of workshops that you're offering. And I noticed in the description, you say healthcare workers and leadership training. What about for the family caregiver? Are they welcome to attend? Absolutely.
Just because you're not getting paid doesn't mean you're not a healthcare worker. You are in it every day as, you know, official or professional healthcare workers are, and you're experiencing the same trauma and experiencing the same compassion fatigue. So absolutely, I think these strategies that you will learn as in the healthcare worker training would be especially beneficial for volunteers or home health aides or family caregivers or anyone experiencing compassion fatigue.
Could you please really encourage our viewers why this is so important and a few hints about what they're going to get out of attending one of these workshops? Blanca?
Sure, of course. Well, I think now more than ever, self-care is very important in general, not just for healthcare workers or for administration or for even, you know, someone at home taking care of a family. So, you know, we want people to learn, you know, new skills, new strategies to help themselves personally and professionally, to build resilience and to manage, you know, the impact of trauma and of grief. You know, we want to support emotional wellness, and we really want to help, you know, prevent burnout. We don't want people to get to that stage, because again, it's all about self-care, and you know, self-care is kind of on everyone. So everyone needs to kind of create the time and the space for it. And with everything going on right now, that's kind of hard. So I think now more than ever, it's important to really, you know, encourage that and make time for it.
Right. So from my perspective, it's compassion fatigue creeps up on you, and you need to take proactive steps in order to make sure that it doesn't happen. So you learn what you should do immediately to start preventing those things from that emotional and physical drain from creeping. I mean, if you've been providing care for a while, then you know what it feels like to have that burden. And in the future and now, you don't want that to continually happen to you. So be proactive about it. Take control of your own health, your own mental health, your own well-being. It's important that you be proactive and take a training and learn the strategies and resources available to you, so that before you even start feeling burned out, you're taking steps to prevent that, and so that you can continue providing care to not like your loved ones and also your clients and patients.
Wonderful. And I think this is why this is such an excellent opportunity. It's being led by an internationally recognized trainer who is a specialist in delivering trauma-informed training. So I think for our Montgomery County residents, this is a tremendous opportunity. So what I'm going to do is put all of the details about the dates and how to register also on the link where people found this show, so people can also share that with their friends and loved ones. I want to thank both of you for being here today. This has been a terrific opportunity, and I thank you and I wish you well with this program.
Thank you, Lily.
Thank you.
Wonderful. You have been engaged at home. And this has been an opportunity for Montgomery County residents to learn how to connect with valuable resources. As I say with all shows, I want to remind you all to stay well and keep calm.